Hi, I'm here with Lisa Alexander, who has just graduated the Breathing Deeply Advanced program. So she is a new, but been studying yoga therapy for several years with us, and she's going to talk to us about a case she worked with. So I'm glad to see you, Lisa. And why don't you start with your client and what her condition was, and we'll take it from there.
Okay, well, thanks for having me and letting me do this. My client is a 76-year-old woman who was diagnosed with aggressive breast cancer, and her diagnosis came back HER2 positive, and she had a lumpectomy. So about 6 weeks after she had her surgery, she was deciding whether she should do this aggressive therapy. So she went and she sought out a few different oncologists. She was a retired oncological nurse, and she really knew the side effects would be pretty terrible. And she was just looking for some alternative methods to deal with this as well, because she has been doing yoga for 40 years. She also, when she worked in England, they treated the whole body, spirit person, and they did conventional medicine. They also did mind, body, spirit therapies. They did yoga therapy. They did nutritional therapy. So she was seeking something like that, which is kind of missing here, she thought. So in her decision, her final decision was she felt, her words, bullied into taking this conventional therapy, but she needed something holistic, something that she felt like was in her control. So she was a yoga student of the studio where I teach and I own. And she called me one day. I hadn't seen her in a long time, and she said, I understand that you're doing yoga therapy, and I think this is what I'm seeking to do as an additional treatment to my conventional treatment. So I did an intake with her, and she needed something right away. Unlike most of my cases where you have an intake, you also, whether you do muscle testing or you look at the whole picture and you send them home with something to do. She wasn't interested in that because she wanted to see me every week the day before her treatments. And she knew that she wouldn't really be able to do a lot of physical things because it would take her probably the whole rest of the week to recover. So for me, I felt like my work was about giving her certain things that she could do at home, meditation, breath work, mantras, chanting. She loved all that. I knew that piece would probably be easy because she was a practitioner for so many years. And then the physical piece, I would work with her each week that she came in. So I started.
So she was looking for a physical practice because that was her best day of the week?
Yeah.
Is that what you're saying? I see. And then you were giving her other things she could do as her treatment. And so you're just doing mostly like treatment mitigation, like trying to reduce the effects of was she on chemo or
she was on a very aggressive chemo. She was on Taxol and Herceptin at the same time, plus taking steroids the night before the treatments.
So she was looking to reduce the effects of those and also like sort of tend to her physical self?
Yes. And also, as I said, she was an oncological nurse, so she understood how important it was to not let lymphedema set in, scar tissue build up. So she had a port put in. So the second or third week I saw her, we started working on actually wall walks. So we wanted to, because she had surgery on her right side, she had the port on the right side. We just started working that arm. We worked both sides, but we started working that arm. She was a little tender. She did get permission from her doctors that she was okay to exercise as long as she felt fine. So really, for the first 2 or 3 weeks that I saw her, we worked on just some little movement like this, some moving and breathing. We also did the wall walks, and within 3 or 4 weeks, she felt better. I started to add in some warriors with a lot of moving and breathing, the joint freeing series. And meanwhile, just when she did come in, she loved Ujjayi breathing. So we did a centering, we did Ujjayi breathing, we did some joint freeing series to warm up the joints. We went to the wall, did our wall walks. I started to add in Warrior 1 and Warrior 2 with this movement, goddess movement, straight up. And then
and that was all in service of like making sure her scar tissue didn't build up and keeping her mobility.
Yes.
And the breathing was for.
Was.
And the breathing. What was the breathing for? Why were you giving her breathing exercises?
She just really connected to breath work and just felt like just breathing in made her feel very whole. It made her feel like her cells were healthy instead of, because they were killing her cells, so she felt
Sure.
breath work was really important with the moving and breathing. And so
it kept her more mentally buoyant as well. I'm hearing like that was helping her mental states for her. Okay.
Yeah. And when I gave her a mantra to do, she loved chanting and she loved doing mantra work, and that was very helpful in the days that she had her treatment. So when they put the intravenous in her arm and the medicine into her arm, and then she had to stay there 3-4 hours. She would meditate and she would chant silently. And she said it was just a way of her having control and settling and grounding. And in doing this, she also, she walked every day, and she walked 2 miles every day. And the days that she just really needed to rest, she didn't. I did offer her a yoga nidra. I thought that would be helpful. She ended up not liking that at all. She was too restless with the steroids, and she just felt like the chanting grounded her better. So I was like, do what's best for you and what feels good. So I'm like,
so you're able to give her different options, and did she feel like she was, it must have been nice for her just to be picking from different things that could help her mental states, right?
Yeah, and I got her mala beads, so we did Om Namah Shivaya. She loved that, so she was open to a lot of things. I thought she'd be really open to the yoga nidra, but she was just too restless, and those other things worked better for her. So then I just suggested just keep doing what felt best for her. And so I would say around week 6 so she had Taxil every single week with the Herceptin, and they said week 2 you would lose all your hair and you would be vomiting all the time. So we were just trying to mitigate some of that with the work we did. If I can give you one little story, she came in probably around week 6 or 7, and she was pale. There was no energy in her body. In fact, I didn't want to work with her. And I said, today might not be a good day. Why don't we see each other next week? And she said, I'm here. Can we please try? And I'm like, oh, of course. And if you're not feeling well, then we'll just stop. And she goes, I'll go home. So we did a lot of breath work. I didn't do our typical, because I kept adding in each week, Vera 1, Vera 2, So I did a lot of breathing. We did some meditation. We did some joint freeing, very gentle. At the end, we did a nice shavasana with Nadi Shodhana, and all the color in her face came back. And I think it's just a testament to the human body and the human spirit. And I think we're meant to move. And if you can, and she wanted to, she was willing to, she just felt so much better. I personally, I've never seen anything like that. I mean, I've never worked with cancer clients before, but I know people, and I know people that have been sick, and I've witnessed that. And
Sure.
she was pretty unlike most people I've witnessed. So for me to see that, at first I was a little nervous, like, no, I don't think, you look really tired, but she wanted to do it, and we went slow, and she was so happy that she did it because she felt better.
Great. So yeah, I'm hearing the sort of week to week, and maybe you could talk just a little bit about your relationship. Did you guys, seems like you must have had a pretty solid relationship with her.
We
did you feel?
We did. Like I said earlier, I had known her from the studio many years ago. She came to my classes, and then with her schedule changed, she went to other teachers, and I'd see her in passing if she was at the studio at a class, but I hadn't really seen her in probably a few years. And so, but I knew her. And with this, we definitely made a connection. Yeah, and working so closely with somebody, and somebody being so vulnerable and being sick, and sharing her anger, sharing how vulnerable she felt. We did. I felt closer to her. I mean, we did have a really nice client-therapist relationship, for sure.
Yeah, that's well, to be able to support someone in that way, and to have that for her must have been really nice.
Yeah, it really
during
was.
such a hard time.
Yeah.
And so you worked with her for several more weeks. How would you say it went overall? Like, did you see her through a certain portion of her treatment, or how did it?
I did. I got to. I worked with her actually. I probably saw her 19 times, but over 6 months. There was Christmas and the holidays in between, so we took a few weeks off there. But around Thanksgiving, she finished the Taxol, and the Taxol was just the pretty aggressive treatment. She was still on the Herceptin, but she finished it, and then she was going to, from that point on, she had 3 weeks off before she started radiotherapy. And she told me that she had to keep her arms in this position for at least 10-15 minutes when she went in to get her markers done. And so for the next 3 weeks and beyond that, with all the joint freeing series and all the asanas that we did for the port and for her surgery, now we started to hold that so she would get stronger. And by the time she did her radiation treatment, she could easily hold her arms up for 10-15 minutes. She was so thrilled. The first time she came back after her first treatment, she was amazed. She goes, it was a breeze, not the treatment, but just being able to hold her arms up. And she said, that's all the work we've done. So she was excited about that. And we kept that up. She was pretty tired, though, with all of it, of course, but the radiation was tiring for her. She said she felt tired, unlike kind of the tired that she's ever known in her life. It was just very tiring. But she never in 6 months missed a week. Never.
So she was she was a good client. Like, she was dedicated.
Yeah. I could not have asked for a better client, my first cancer client. And she never lost her hair. And
interesting. Yeah.
Which was shocking to people. And she never vomited once.
Right. All because of yoga therapy. No, I'm just kidding.
Well, no,
but
I don't think so. But
who knows?
We don't know. I mean, she had anti-nausea medicine, but she just said she would have never had the energy to do some of the stuff she did do had she not done this piece of it, this piece of treatment that she.
And so how did you end it? Like, how did you guys decide to be done with your work? Was she finished? Did she feel like she was?
Wasn't. She would have still join me each week, but each winter she goes to England. They have an apartment there because she has dual citizenship. So for the winter, she went to England. So that was, in fact, I heard from her today. She's home. She got home a few weeks ago. She still has to have her septin for a year, so that'll be up in September. But she's quarantined because she came back from England, and she is still able to have her treatment. She is allowed to go out for that, and she let me know she's still walking 2 miles a day.
Oh, great.
Yeah.
Great.
Yeah.
So, I mean, you did really wonderful work with her, and you know, I got to be your practicum advisor through that, and I saw the decisions you were making. Maybe you could just speak just a small amount about like your experience of working with her in the context of being in the practicum versus being on your own, I guess.
Yeah, sure. There's
useful?
nothing like having support, right? So this was my first cancer client, and it was interesting because in that piece of it for our school, when the presenter who was presenting on cancer, when Debbie said, if you're not comfortable with your own death, you shouldn't probably work with cancer clients. And that struck me. That just struck me. And am I okay with my own death? So it made me think about this. And then all of a sudden, the end of summer, here this person was. And I was ready. I felt I wanted to do this, but I don't know if I would have been ready if I didn't have you or my practicum colleagues to go to and say, this is happening. Is this the right direction? Am I thinking in the right direction? And so the practicum was so helpful, and it made me less worried that I would do something not good for this person, that I might not give the right protocol, or I might not give the right breath work or the right meditation. And so it was extremely useful, extremely helpful, and I felt very supported.
Great. Well, yeah, I mean, I was there listening to you, you know, as you assigned her things, and you did an excellent job with her. And she definitely had the outcomes she was looking for. And it's a good example of how yoga therapists can support people going through these treatments, because, you know, we're not going to cure them. So the question is always, what is our role? And, you know, you kind of really nailed that. And you're like, I can help you get through this. I can help you feel a little bit more agency, and I can mitigate some of the symptoms of the treatment, which is our roles. And you did that beautifully. And I just also want to say that, you know, you're presenting this now, but I got to work with you with a lot of different clients, and I have to say you're definitely a capable yoga therapist. And we're so proud that you've gone through our program. So thank you for sharing that case study with us. And, you know, I'm looking forward to seeing, you know, what you do with yoga therapy in the future. So I'm excited. So thank you.
Thank you. Thank you for all your support.